Well, the visit with the President and Karen Kaler went very, very well today. And what we tried to do in the time that we had with them was to really give them an overview of the kinds of research that we do in public health. We talked about our engagement with the National Children's Study, with Pat McGovern and her crew, and that's an extremely important study because that's actually going to be following babies who are being born right now all the way up to their young adulthood, and that will help us understand a lot about their health. We talked with Dr. Diane Newmark-Steiner and her PhD student, and what we explored there was the whole issue of family eating. We talked with Dr. Beth Vernick, who's our Associate Dean for Research, and Beth works with very large data sets, in this case the Medicare data set. And the reason that that's important is because out of those very large data sets, we can learn a huge amount that can impact clinical care and that can also impact public policy virtually overnight in some cases because the data are so persuasive. We also spoke with Dr. Michael Osterholm and Dr. Nick Kelly, and they talked about the issue of public health infrastructure. These are things we often take for granted. The electricity that comes on every time you hit a light switch, the food that you buy in restaurants and grocery stores. We take them for granted except when they're not there or when they go wrong. And then we topped it off with a discussion with Jim Neaton and one of his graduate students. And Jim is one of the highest funded NIH researchers in the world. And for some 30 to 40 years, Jim has been doing work in the area of public health trials, clinical trials. And the current trial that he's working on is the largest AIDS drug trial in the world. I think that the hit of the day, without a doubt, was Ali Hassan Ali. And I might add that I think that he has a budding career in public health.